If I could, I'll just address the question on the stakeholders and how we engage the stakeholders. We work very, very carefully with the stakeholders in the process as the bill was going through the process last year to help identify what resources would be needed and how we could actually implement this. A lot of the trailer bill legislation is the result of things that were not able to get included into the bill before its passage, to just operationally clean it up, some technical cleanup, and then make some clarify the statutes a little bit about what the department will and won't be able to do so that the public understands what this actually will mean for them in terms of getting a home care aid through this registry in the future.
Okay, thank you very much. LAO comments?
Because this is a new line of business for the department that comes with additional responsibilities, we think the workload is justified and don't have any issues to raise at this time.
Thank you very much. Department of Finance? All right. Any comments from members? Public comments? Welcome.
Hi, Madam Chair and members. My name is Brandy Wolf. I'm the Deputy Policy Director for the United Long-Term Care Workers Local of SEIU. We're one of the stakeholders who worked with the department for countless hours over the last few years. ULTCW represents 170,000 home care workers in 10 counties throughout the state. For just very brief historical context, ULTCW, along with the Congress of California Seniors, was the co-sponsor when this bill was SB 411 in 2011, and also last year when it was 1217 by Assemblywoman Lowenthal. 1217 was ultimately the language that was signed into law, which is what the trailer bill is proposing to amend. At the end of last year's session, the sponsors committed to work in good faith, as we had for the last 3 years, with the department for some important technical cleanup. The issue that we have today is sort of the process that's played out in this budget cycle. The trailer bill language was put forth without any consultation in the interim with the stakeholders. That's our primary issue. We also have some concerns with technical aspects of the language. One example is the Attorney General's office and the interim contacted Assemblywoman Lowenthal's office and requested some technical cleanup to the background check language. And because there was no sort of consultation before the trailer bill language was put out between the department and the author's office or the sponsors, that requested language from the AG's office is not included in the trailer bill as it currently is. So we would just request as the former sponsors of the legislation that DSS continue to work with us in good faith so that what comes out in the May revise is the proper language.
Thank you very much.
All interested parties are satisfied.
Ms. Leary shaking her head yes.
Yes,
I think you have
absolutely.
that.
Thank you.
Thank you very much. Good afternoon.
Oh, yes, now I'm back. It's the afternoon. Gary Passmore, Congress of California Seniors. As Ms. Wolf said, we sponsored AB 1217, and I'd like to point out that we're also working with SEIU, ULTCW to co-sponsor AB 2556 by Assemblymember Chow, which involves some cleanup of the language in this. We too would like to see a little more robust engagement in the implementation part of this legislation, but generally we support the budget.
All right, thank you very much.
Good afternoon. I'm Jennifer Gabalis. I'm Director of Policy for the California Association for Health Services at Home. At Home, we represent the home care agencies that will be impacted by the implementation of AB 1217. We look forward to working with the department and establishing a cost-effective, streamlined licensure process for agencies. We are concerned about what the final amount of the licensing fees will be, and will be very cautious of the type of work and services that the department will be responsible for, because we obviously are going to be paying for that. And our ultimate goal is to keep services available and accessible to consumers, and a lot of that is associated with what our fees are and what we turn around and are required to charge them. It's very thin line between of what middle-income families can burden when they don't qualify for IHSS and they don't have unlimited resources. You know, we have to be very cognitive and aware of how this impacts the middle class and their ability to purchase care to remain in their home as they've chosen to do so. So again, we're looking forward to our developing our working relationship with the department as implementation moves forward. We do not have any issues with the trailer bill language. We were given the opportunity to review that, and we appreciate that. And thank you.
Thank you very much for your testimony. This item is recommended to remain open so we can continue to address issues raised today. Thank you very much. Thank you very much for your presentation. I know we'll be continuing the discussion. And thank you. So the next item is the Department of Social Services SSI SSP overview. Welcome to our testifiers as they come up.
Again, Will Lightbourne, Director, CDSS. Good afternoon, committee. Let me just quickly turn it over to our Program Deputy Director, Pete Chervinka, for the SSI SSP presentation.
Good afternoon.
Good afternoon. Thanks for having us, Madam Chair and members. My name is Pete Chervinka. As Director Lightbourne said, I'm our Program Deputy Director here at the department. We appreciate the ongoing collaboration with your staff in the development of an agenda, so largely what I'm going to say for SSI SSP is already reflected there, but I'd like to hit some of the high points for you. The SSI SSP program is a monthly cash benefit that's provided to eligible age-blind and disabled persons in California. Its intent is to meet their basic needs for food, clothing, and shelter. We serve about 1.3 million people every month in this program, and it grows by about 1% per year. It's a fairly long history if you look back over the last 10 years. The SSI portion of this, the Supplemental Security Income portion of this, is funded by the United States Treasury, and those funds do not run through the state budget. The SSP, or State Supplementary Payment portion of this program, is funded directly by the State General Fund. We receive slightly over $7 billion in federal dollars, or rather the recipients receive about $7 billion a year. And the SSP state portion of that, we spend about $2.5 billion per year on that. There is no, a few years back, a state COLA that was automatically provided every year on the state portion of the payment was repealed, so there is currently no state COLA associated. The federal government provides on the SSI piece of this grant an annual federal COLA that's based on the Consumer Price Index every year. In January that just passed, there was a 1.5% increase, and it's projected to be another 1% increase next January going forward. We pay the federal government to administer this program on our behalf. They do everything for us. On this, we pay them about $180 million a year to do that. They determine eligibility, they determine the benefits that people are entitled to, they correct the payments if they make any errors, and they actually issue the payments on our behalf. So we pay them to do that for us. We are required to have the SSP program as a condition of accepting Medicaid funding, which is Medi-Cal in California. We're required to maintain an SSP program. We have about 20 different categories that are established for either individuals or couples and their various statuses. We maintain now at the state the 1983, March 1983 payment standard for all of those categories in California. That's the minimum level that the feds require us to maintain, and that was as a consequence of federal law that was passed some time ago. I don't really have anything more. The agenda includes the average grant amounts for you. Individuals, the combined SSI SSP grant takes them to the maximum grant takes you to 90% of the federal poverty level for individuals, and for couples receiving a grant, it's at 113. Again, the maximum is at 113% of the federal poverty level. I'm happy to answer any questions about the program.
Thank you very much for answering the requested question. Any comments, members? Any comments from LAO?
Rashi Kasarwani, LAO. We'd simply like to add that the cost of reinstating the cost of living adjustment for the state-funded SSP portion of the grant would be about $50 to $60 million in 2014-15.
Thank you very much.
Could I just ask?
Yes, Senator Monning.
What would be that? You said the amount, but what would the percent adjustment be? It would be a COLA adjustment?
It would be based on the California Necessities Index. So depending on what that percentage is for January 1st. So my colleague Pete Chervinka with the department is saying 2.14%.
Mm-hmm. But that's adjusted annually, that index?
Correct.
Mm-hmm. And does this represent the current index, 2.14%?
Right, yes. My estimate assumes the expected California Necessities Index percentage for 2014-15.
And when was the last time California employed this index to increase the payment to recipients?
Okay. I think Pete has
Again,
the
I'm
information.
just curious because we've
in terms
been
of the
in
year.
very lean times, and
Yes, it
these
has been
programs-
several years, and we did suspend the COLA, so it's not normally applied.
Mm-hmm. And the federal government doesn't require us to employ that.
No, it does not.
Yeah. So the last time the state actually provided this COLA was in June of 2008, and it was a 3.7% at that time. In years that followed that, typically what happened is that we held recipients grant level constant, and when the federal COLA passed, we reduced this amount the state contributed. That's not something that's available any longer to California. That was a budget savings measure. We're now at the minimum payment standard, so we pass through the federal COLA at this point every year.
Right. So in other words, we can't adjust down any farther and be
That's correct. Both
with the law.
individuals and couples are at the federally required minimum payment standard for individuals and couples.
And again, I appreciate the clarification. I know we'll hear probably from some of the witnesses, but on a budget line, it reflects $50 to $60 million in the lives of people dependent on this as their only source of income. With all costs going up on all fronts, you have even though it might remain constant, it's taking the recipient deeper and deeper below a federal poverty line. So I just think it's important to have the human face connected with these numbers and how it's impacting our communities. But thank you, Madam Chair.
Thank you, Senator Money. Does Department of Finance have any comments? All right, thank you very much. Public comment?
Thank you, Madam Chair. Mike Harold with the Western Center on Law and Poverty. I think, this year in the legislature, there is a lot of discussion about the issues of poverty in California. We now know that there's some 8.7 million people living in poverty in California. The result of the cuts that were just discussed in this previous discussion, we reduced the SSP portion, the state-funded portion of the grant, by $77 a month. We went from $233 down to $156 a month, the bare federal minimum. We also repealed the cost of living adjustment in 2009, have not provided a cost of living adjustment since that time. So In that period, we have taken 1 million California recipients who are single individuals receiving SSI, and they went from about almost exactly 100% of the federal poverty level and have now dropped to 90% of the federal poverty level, a stat which is in your analysis. So one of the things that I think you need to just be cognizant of is the ongoing impact and loss of purchasing power that this population has suffered through both these cuts and the repealing of the cost of living adjustment. Unless this trend is reversed, that 90% number is going to continue to drop and decline, and we're going to see this population living in deeper and deeper poverty as we go forward. So the request of the Western Center is that we restore the $77 back to the grant, and we restore the cost of living adjustments. And by doing so, we lift 1 million people out of poverty in California by doing that. And it's one of the most effective ways that actions we could take you could take as a legislature to reverse the trend of more and more poverty in California. Thank you very much.
Thank you very much. Good afternoon.
It is afternoon, isn't it?
It is.
Chair Corbett, members of the committee, welcome? No, I'm welcome. I'm getting welcome. Anyway, my name's Chris Jensen. I'm with Resources for Independent Living. We're an independent living center that provides services to people with disabilities in both Sacramento and Yolo counties. And I just want to start off by saying that we're in complete agreement with the Western Center on Law and Poverty in their assessment and ask. One of the things that brings us here often is many cuts are applying to the same population. We've seen cuts to SSI, SSP, cuts to Medi-Cal, cuts to IHSS, all affecting the same group of people over the past few years during the dark days of the Great Recession, where many difficult decisions had to be made. So I think looking at it as a complex of cuts and trying to bring independent living as a better alternative for people. If you don't have the systems in place, then independent living is very difficult, if impossible, to achieve. One of the things I wanted to highlight was in regards to housing. This particular population falls into the category of the extremely low income. And speaking for our county, Sacramento County, if you look on the graph, it takes about 75% of their income to afford market rate housing. And there's very little subsidized housing available these days. And I got an email from one of my colleagues with some information that for every 100 extremely low income households, the number of available units shrank from 23 in 2006 to 16 in 2012. So for every 100 extremely low income households, only 16 units are actually available. So there's a lot of competition for those. So a lot of folks are paying above 50% of their income in housing, which is an overburden. They have to choose to spend on food and all these other things. So we really ask that you take a good look at this to help reinstitute some of that income for them.
Thank you very much for your testimony. Good afternoon.
Good afternoon, Madam Chair. Senator Monty, I'm a face to it. I went from $989 down to $790. My rent in Alameda, in Pleasanton, is $1,376. On the income I get, if it wasn't because my provider is my stepson, he works for in-home supported services, we wouldn't be able to live there. And as of January, with this overtime issue, he will lose 130 hours and we will be on the street. And I can't afford to be on the street with my medical problems. We have to choose if he buys my medication or food. If I can travel to go to a meeting to discuss the issues, or I have to stay at home. Lately, I've been stuck at the hospital more than I have been at home. So these things are affecting us in cuts from every single area. I'm not the only one. I represent at least 1,000 people in my community that have that problem. And they don't just get cut one. When you have a mother and a son on SSI both, they both get cut. One of my consumers lost $600, $300 from her son and $300 from her, because they both lived together and she was his IHSS provider. She got cut from IHSS, she got cut from SSI, she got even cut from her work because the assessment was done incorrectly for her son, and he's a quad. So these issues happen. We are out there. We are suffering. We have to choose if we want to eat or get our medications, or if we want to live or sleep on the street.
Thank you for being here today. Would you mind sharing your name with us?
My name is Carmen Rivera Hendrickson, and I'm part of the Alameda County Advisory Committee.
Thank you so much.
Thank you very much for being here, and thank you for your comments.
Gary Passmore, Congress of California Seniors. I doubt that I have to say this, but I'm going to say it anyway. These SSI, SSP arrangements are an outrage. They are leaving probably 1 million people in California in a really desperate situation. And I want to draw to your attention something that doesn't often come up, and that is because the state chooses its cash-out policy, where we essentially fold any food stamp eligibility into an overall payment. There's been a good bit of research done in California, and it systematically discriminates against older people on SSI, SSP. Seniors would be much better off to do what a lot of states do and separate these programs. I'm not advocating it today, but I hope you guys will keep your eye on this program. Thanks.
Thank you.
Deborah Doctor, Disability Rights California, in support of the Western Center's comments and proposal. 90% of federal poverty level is not something to be proud of, and it has nothing to do with the cost of living in California. And a difference of $70 or $80, as Carmen said, it's different from you losing that or me losing that. The choices that have to be made are life and death choices. I can't think of any group for whom the cuts were crueler that you all had to make or felt you had to make over the last years. And my suggestion would be that the most hurt should be the most helped at this point. First help. Thank you.
Thank you very much. Good afternoon.
Good afternoon. My name is Robert Colby. I'm a concerned citizen. And I agree with all the other people. Can't you find any other wasteful programs and cut that and put it back in the SSI, if that is possible? Just try to pay a rent with what you get on SSI. It's not easy. Thank you.
Thank you very much for being here, Robert. Hello.
My name is J.C. Orton. I'm from the Catholic Worker in Berkeley, California. I have a family of 150 to 250 homeless, chronic homeless people that far exceed the government guidelines of a year or two, 15 and 20 years homeless. Many of my people receive SSI benefits. They get a $961.40 allotment every month. I know this because for many of them, I am the representative payee. I make sure they have $1 in their pocket. The intent of SSI and SSP is what this gentleman here was saying, what the intent was. The reality is perhaps something a bit different. Trying to get $961 to house somebody is impossible. There's no way to go and get your rent, your first and your last month's deposit. You can't do that. There's restrictions on what you can hold at any one time. I would hope that the monies that are out there, the government is holding, Jerry Brown is deciding where it gets moved around, will be applied to where there is need. If we continue on this, as we continue the downgrade of benefits to people in need, what we're going to do is we're going to be supplementing homelessness. As people move from marginalized, we're going to increase our homeless population. It'll never put me out of business. That's my job, to work with these folks. Make my job easier. Make the changes. provide the monies as much as you can. Thank you.
Thank you very much.
Hello, good day. My name is Ekaterina Burton, and I'm from the Alameda County Community Food Bank, and also here representing the California Hunger Action Coalition, which is a statewide coalition of many different organizations who care about the ways in which that we can end poverty here in California. So I just wanted to remind everyone that, again, we're #1 in the country when it comes to poverty. Our poverty rate is the highest in the nation. And to echo what many have said here, you know, our food bank is especially concerned about SSI because we know because families with folks who have SSI may be eligible for CalFresh, but those individuals or couples who are living on their own and therefore are not eligible for CalFresh, they're coming to the food bank. They're coming to food bank just like ours because they need help with paying for that food because with getting that food because they cannot afford to pay for it because they're paying for their medicine or other items. So, you know, we see this as a concern that, you know, we have the ways to help people be out of the poverty line by increasing the grant level to what it was in 2006, restoring the COLA adjustments every single year. And we think this is one of the ways that we can end hunger and end poverty and have less people coming to the food bank. And also, you know, keep in mind that many of the people on SSI, SSP are women, you know, over 50%. So this is an issue that really touches on all parts of the community and are people who we know have not been able to work most of their life because of their disability. So they're our most vulnerable citizens, and how we are treating them, how we are caring for them, how we're taking care of them, it reflects a lot on our state. And so we hope that in this budget that you all fight for increasing benefit levels to them so that the burden is less on the food banks and other safety net providers so that we can provide for those who don't even have access to any part of the safety net. Thank you so much.
Thank you very much.
I'm Kevin Shields. I'm on the board of directors for a few different disability advocacy groups, and I work at a university with a big tall tower in the middle of it in the Bay Area. Hey, every penny that you guys increase to these poor people is going to go right back into the economy. Nobody's saving any of it or hoarding it away. It's all going right back into local stores and to buy food and things like that. So think of it that way. It's bolstering the economy because none of it's going to savings.
Thank you. Very good point. Thank you.
My name's Jerry Williams. I've been a care provider since 2006. I take care of my son. With these cuts happening, I would lose half of my income. My son is mentally challenged. The thing he worries about most is being put in a home. He asked me before I left here yesterday morning if that was going to happen, and I said, no, it's not going to happen. So these cuts, that's all he's worried about, and these cuts cannot happen. It is crazy if it is going to happen, and you can't make these cuts happen. So let's, you know, do what we can. Thank you.
Thank you very much.
Karen Kiesler with the California Association of Public Authorities. 85% of IHSS consumers are on SSI, SSP, and we've historically supported the restoration of the COLA. Thank you.
Thank you very much.
My name is Nani Lofstrom, and I'm a consumer, and I beg you to restore the COLA. In 1980, I ran into a burning building, and I became disabled. And at that time, I had a pension, I had a teacher's pension, I had a home, I had a car, I had insurance. Now I have almost nothing. I've been homeless 19 years during that time, even though I've gone back to school. I don't have any hot water in my house. I don't have a stove. I have a cooler. I go to the Y and spend $31 so I can bathe and get dressed and stuff like that. I'm in jeopardy of losing where I am right now. I'm 67 years old. When I was 65, when I was 55, I could get Project Open Hand, which was good food that helped me heal. Now the food that I have access to, most of it is out of date. I can't cook it, or I'm allergic to it. I'm not eligible for food stamps. If I was eligible for food stamps, I could get some decent food. I've paid off $30,000 of my $60,000 student loan debt, and I can't get a job because I can't transition. I work as part of the In-Home Support Services Advisory Board, and I get $75 a month. They take $5 away because I have only $130 in SSI. And so then they take stuff away. They say they would rather take it away, you know, than overpay me or underpay me. And then I go up for a review again, you know. I don't have glasses and I'm at a fall risk. So because glasses is no longer included, you just can't cut 7% more, you know, or I will be homeless. And I am not going to make it this time because I have too many medical conditions from being on life support. I've got, and I'll speak ahead because we may have to leave, managed care would be the worst thing in the world for me. It would institutionalize me because most of my doctors are at Stanford and UCSF, and they don't go with Alameda Alliance. They don't get referrals. I've been asking everybody. Alameda Alliance doesn't like to refer, you know, to the major universities. And that's where I get all my specialized care. Where I get my orthopedic care, Webster Orthopedic, they won't take Medi-Cal and Medicare anymore because of the cuts. We need that 7%, you know. I keep picking myself up off the ground and advocating and trying to work, and because I'm in a transitional period, I lose too much, and then I lose my housing. And please do not restore the COLA.
Thank you very much for your testimony.